Hello and welcome to our Fascial Fix for tinnitus and ear pain. Tinnitus is the ringing noise that you can get in your ears. Sometimes it's constant, sometimes it can vary, and very often it's associated with ear pain. From a medical point of view, it's often difficult to establish exactly what the cause of your tinnitus and ear pain is, but it can often be fascia and restrictions that have formed in the fascia in and around your ear and your neck. In this video, we share some exercises that can help to alleviate some of these symptoms. In this video, we're going to work on the sternocleidomastoid. That's a bit of a mouthful, but it is a muscle that wraps from just behind your ear, round the front of your neck, and attaches into your collarbone and your breastbone. There's one on either side, and they help to turn your head from side to side. Now, when these get tight, they can cause restrictions, but they can in particular cause tinnitus and ear pain because of where the muscles attach into here, just below your ear. So to work on this, we're going to work on the right one first. If you turn your head to the right, and then bring your ear towards your right shoulder. With your left hand, bring it across your body and just take hold of the muscle. It is quite superficial, so it's just under the skin. It can feel a bit like a greasy rope. And just take hold of it and compress it gently between your thumb and your fingers, and this can be anywhere between your ear and your breastbone. And as you're here, you may find that you feel points of pain that may increase in intensity and then just ease away. These are trigger points, and they can cause referred pain patterns, very typically into your ears, into your face, and sometimes into your jaw as well. And they are part of the cause of jaw pain and tinnitus. So when you've been on one point for a couple of minutes and you feel things starting to soften, then you can move to another point. So you take your thumb and your fingers off, find another part of the muscle, and just squeeze it gently again. And again, you may find that you're on a trigger point, which then just gradually starts to release and let go. And at home, you can spend as much time as you'd like working on different points on your sternocleidomastoid. And then we're going to work on the other side. So for this side, to work on the left, you're going to turn your head to the left, bring your ear towards your shoulder. The reason you do this is to relax the muscle, because if the muscle's tight, it's very difficult to get hold of, but when it's relaxed, it's a lot easier. So bringing your other hand, your right hand over, you're going to just take hold of a section of the muscle, and then just gently squeeze between your thumb and your fingers, just compressing the muscle. If you find a point that feels tender or refers pain, then you're on a trigger point, and you just wait here and allow that to start to release and let go. And as long as you're on any point for at least 90 seconds, then the fascia and the restrictions will start to ease and undo. And as you feel that happening, you can release your pressure and again move your thumb and fingers to another point. And again, just squeeze gently, waiting for a sense of the tissues softening and letting go. In this exercise, I'm going to use one myofascial ball on the side of my neck. I'm going to place it on the side of my neck just under my ear, and then I'm going to lie on this on my side. So when you're here, in order to feel an actual pressure from the ball, make sure that you pull your shoulder forwards. And this just means that your neck can rest on the ball. And just allow time for your body to start to relax around the ball. The area on the side of your neck can get very tight. There are nerves here which go down into your arms, and these can get tight and start to cause problems in your arm. And equally, tightness in the side of your neck here can cause problems in terms of jaw pain and headaches. So it's a good area to release, and by lying here for at least a couple of minutes, it's allowing time for the fascia to release and let go. If you find that lying on the floor is too difficult for you, then you can also do this exercise on your bed. And just allowing your body to relax around the ball and get a sense of the tissues starting to soften as you do so. And once you've been here for at least a couple of minutes, then you can do the same thing on the other side. So again, as you lie here, pull your shoulder forwards so your arm is out of the way, and that you get a sense of your neck being able to relax onto the ball. Make sure that your body feels comfortable, and whether you're on the floor or on your bed, that you can just relax around the ball. As long as you're here for at least a couple of minutes, then the tissues will be starting to release and let go. Sometimes you may feel sensations that may go down into your arm or up into your head and your jaw. So whatever you're feeling is fine, that's right for you. Just allowing time for the tissues to release, relax, and let go. So staying here for a couple of minutes allows time for the fascia and the soft tissues to start to release. And you may notice changes, sensations that come and go, and that's all fine. That's all part of the process of your tissues releasing. In this exercise, we're going to do a throat stretch. So to do this, you can either do it through clothes or you can do it directly on skin. Sometimes working directly on your skin means that you get better contact and traction. So you can experiment at home to see what works best for you. So you're going to cross your hands, place them on your chest, just below your collarbones. So if you imagine the palms of your hands sinking gently through your clothes, through your skin, and making contact with the tissues underneath. So don't worry if you don't actually feel that, but just imagine it, because the more you imagine it, the more it will start to happen. And so you may start to feel that the tissues are a little bit softer under your hands. And you can then start to allow your arms to be a little bit heavy. So as that happens, they'll start to pull slightly down towards the floor. So you're not aiming to move your hands, but you're aiming to get a sense of traction of the tissues in your chest being gently pulled down towards the floor. And from here, you can then tip your head back slowly, only as far as feels comfortable. If this makes you feel dizzy, then keep your head level. And just allowing your throat to start to stretch, and you'll get a sense of stretch that comes up from your collarbones, up through your throat and into the bottom of your jaw. And this is an important area because there are tissues, muscles and fascia here that can get very tight and can restrict the movement of your jaw. So some of the pain that you may get with your jaw and your TMJ can be coming from this area, particularly if you get a sense of restriction in your throat when you swallow. And as you're here, if it feels comfortable, you can turn your head to the side. So if we turn to the right, first of all, and you should feel a stretch start to come up the left side of your neck and your throat into the side of your jaw, just below your ear. And just allow time for that to start to release and let go. And as that feels softer, you can then slowly turn your head to the other side. And again, just allowing time for the tissues to soften and release. And this time you should be feeling the stretch coming up into the right side of your jaw, just underneath your ear. And just allow that to soften and release. So this can really help, particularly if you sometimes have that feeling of restriction when you swallow or when you breathe. And this just helps to open out all the tissues internally in your throat.